Hello, and welcome. Today, we're going to delve into a condition affecting the esophagus, esophageal strictures. We'll explore what they are, what causes them, and how they're managed, providing you with a comprehensive understanding of this common digestive problem. Esophageal strictures, put simply, are a narrowing of the esophagus. Several factors can contribute to their development. The most common culprit is chronic acid reflux, also known as GERD or gastroesophageal reflux disease. The repeated exposure to stomach acid irritates and damages the esophageal lining, leading to scarring and subsequent narrowing. Other causes include esophagitis from infections, such as those caused by candida or herpes, ingestion of corrosive substances like strong acids or alkalis, radiation therapy to the chest, esophageal surgery, and certain medications. Less commonly, strictures can be caused by esophageal cancer or rare conditions like eosinophilic esophagitis. The development of an esophageal stricture is a gradual process. When the esophageal lining is repeatedly damaged, the body attempts to repair the damage. This repair process often involves the deposition of collagen, leading to the formation of scar tissue. Over time, this scar tissue contracts, causing the esophageal wall to thicken and narrow the esophageal lumen. This narrowing makes it difficult for food and liquids to pass through the esophagus easily, leading to the characteristic symptoms of dysphagia, or difficulty swallowing. Esophageal strictures are a relatively common condition, particularly affecting individuals with a history of long-standing GERD. The prevalence increases with age, likely due to the cumulative effect of acid reflux over time. While precise statistics are difficult to obtain, it's estimated that a significant percentage of individuals with chronic GERD will develop some degree of esophageal narrowing. However, the development of clinically significant strictures requiring treatment occurs in a smaller proportion of these individuals. Population studies suggest that males are slightly more prone to developing esophageal strictures than females, but this difference is not drastic. The primary symptom of an esophageal stricture is dysphagia, or difficulty swallowing. This can manifest as a feeling that food is getting stuck in the chest, or a sensation of pressure or discomfort when swallowing. Initially, dysphagia may only occur when swallowing solid foods, such as meat or bread. As the stricture worsens, individuals may experience difficulty swallowing soft foods and, in severe cases, even liquids. Other symptoms may include heartburn, regurgitation of food or liquids, chest pain, and unintentional weight loss due to decreased food intake. Diagnosing an esophageal stricture typically involves a combination of methods. The initial step is often a thorough medical history and physical examination, focusing on the patient's symptoms and risk factors. An upper endoscopy is the most common and effective diagnostic tool. This involves inserting a thin, flexible tube with a camera attached into the esophagus, allowing the doctor to visualize the esophageal lining and identify any narrowing or abnormalities. Biopsies can be taken during endoscopy to rule out other conditions, such as esophageal cancer. A barium swallow study, where the patient drinks a barium solution and eggs are taken, can also be used to visualize the esophagus and identify any strictures. Esophageal manometry, a test to measure the pressure and muscle activity in the esophagus, may be performed to rule out other esophageal motility disorders. Esophageal strictures can be broadly classified based on their cause, location, and severity. Benign strictures, typically caused by GERD or other non-cancerous conditions, are the most common type. Malignant strictures, caused by esophageal cancer, are less common but require prompt diagnosis and treatment. Strictures can also be classified based on their location in the esophagus, such as proximal, mid, or distal. The severity of the stricture is typically graded based on the degree of narrowing, ranging from mild to severe, which influences the treatment approach. The primary goal of treatment for esophageal strictures is to relieve dysphagia and improve the patient's ability to swallow. Esophageal dilation is the most common treatment method. This involves using special instruments, such as balloons or dilators, to stretch or widen the narrowed area of the esophagus. This procedure can be performed during an endoscopy. Multiple dilation sessions may be required to achieve optimal results. In some cases, a temporary esophageal stent, a small mesh tube, may be placed in the esophagus to keep it open. Proton pump inhibitors, PPIs, are often prescribed to reduce stomach acid production and prevent further damage to the esophageal lining, especially in cases caused by GERD. Surgery is rarely necessary but may be considered in severe cases that do not respond to other treatments. Lifestyle modifications, such as avoiding foods that trigger heartburn, eating smaller meals, and not lying down after eating, can also help manage symptoms. Preventing esophageal strictures primarily involves managing the underlying conditions that contribute to their development. Controlling acid reflux with medications, such as PPIs, and lifestyle modifications is crucial. Avoiding smoking and excessive alcohol consumption can also help reduce the risk of GERD. Prompt treatment of esophageal infections can prevent the development of strictures. Individuals who have undergone radiation therapy to the chest or esophageal surgery should be closely monitored for the development of strictures. Regular screening endoscopies may be recommended for individuals at high risk, such as those with long-standing GERD or Barrett's esophagus, to detect and treat strictures early. The prognosis for individuals with esophageal strictures is generally good, especially with prompt diagnosis and treatment. Esophageal dilation is often highly effective in relieving dysphagia and improving quality of life. However, strictures can recur, requiring repeated dilation sessions. The prognosis for malignant strictures depends on the stage of the cancer and the effectiveness of treatment. Recent research is focused on developing new and improved dilation techniques, such as biodegradable stents, to reduce the risk of recurrence. Studies are also investigating the role of anti-inflammatory medications in preventing the development of strictures. Early detection and management of the underlying causes, such as GERD, remain the cornerstone of preventing esophageal strictures and improving long-term outcomes.